The New York Times is reporting that the highly caffeinated 5-hour energy drink has been cited in 13 deaths. And that's why Dr. Frank LoVecchio from Banner Health is with us. Doctor, thank you for joining me.
Oh, my pleasure. Thank you.
Dr. LoVecchio, what are the dangers associated with drinking a highly caffeinated drink like 5-hour energy?
Well, the FDA and U.S. Food and Drug Administration reported today that there were some deaths associated with it. And to talk about the science a little bit, if I have heart disease, I have had a heart attack in the past or a stroke in the past, and I drank a 5-hour energy drink and then had a heart attack that day, you can report that to the FDA. And whether it's related or not, we don't know. And you might have had a heart attack anyway, besides taking it. But the FDA thought enough that there was 13 deaths over the past 4 years that they thought could be related. And they just want to warn consumers about it.
Doctor, I'm a Banner Health heart success story. Are heart patients at greater risk when drinking highly caffeinated drinks? And is the best treatment simply avoidance?
Well, patients who have high blood pressure, patients who have a history of myocardial infarction or angina or heart disease or older patients are much more at risk. And caffeine, we enjoy the feelings of caffeine, but one of the side effects is that it causes vasoconstriction, or your blood vessels to narrow. And that could be a problem, especially in older people or people who have blood vessels that are a problem. About avoidance being the best treatment, I guess when you think about a 5-hour energy drink, it takes you about 1 second to drink it. It's the equivalent of about 2 shots or so. And the problem with it, it has about 242 milligrams of caffeine. A nice big cup of coffee has about 130. So you're drinking the equivalent in cups of coffee, about 2 big cups. If you drank 2 big cups of coffee, there's no way you're going to drink that within, 1 or 2 minutes. And I think people drink it, it tastes really good. They might have another one or, use it in excess. Whereas if you drank a couple cups of coffee, it would take you quite a bit of time.
Right. That seems to make sense. Now, we've had 13 deaths now that have been reported, but have there been any other reports besides the deaths of harmful effects that came from a 5-hour energy drink?
Since 2009 or so, there's been about 90 FDA filings for patients who have had adverse events associated with it. And when we think about our experience with caffeine, a lot of them make sense. People have had convulsions or seizures, and it's more prominent, it appears, in patients who have underlying seizure disorders. We've also had miscarriages. And in theory, perhaps drinking too much caffeine maybe was associated with these miscarriages. There's no way to know exactly because, 1 in 4 or so patients who are pregnant miscarry in the United States now. But heart attacks, we also feel that maybe there's an association because in theory, a burst of caffeine can cause your blood vessels to narrow, and maybe that can cause it. The take-home message from me when I read these reports is maybe there's some science to it, but again, probably avoiding these things, or if you do take them, do it in moderation and realize that when you drink one of these, it could be the equivalent of a few cups of coffee. And if I ask you, would you have 4 8-ounce cups of coffee right now? And people would say, no, I wouldn't. And you'd say, well, you kind of just did by all the amount of, Red Bull energy drinks, 5-hour energy drinks that you just ingested.
Well, what about energy drinks that say that they do not have caffeine? Are people that drink those at a decreased risk?
When I see those advertised on the shelves, I become somewhat, for lack of a better word, angry that they would write, no caffeine. And what they're trying to say is that they don't have the molecule called caffeine. But what they do have usually is a drug like taurine, which is a naturally occurring caffeine-like substance. Essentially, if someone comes in poisoned with caffeine or taurine or guarine, I can't tell the difference. And in fact, a patient can't tell the difference. So they might say something like contains only herbal caffeine. And essentially, it's the same thing. So please be careful and try to read it. Taurine, guarine are the main constituents that look and act just like caffeine.
Dr. Frank LoVecchio from Banner Health, thank you for helping us make sense of this developing news story and also for making smarter personal decisions with our own health.
Okay, thank you. Thank you so much. Please call the Poison Center anytime.